NHA Captain Practice Test 2026 with answers. Question 1. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 2. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B. The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 3. What is the function of platelets, thrombocytes, in the human body? Option A. Transporting carbon dioxide back to the pulmonary system. Option B. Producing specific antibody proteins to neutralize viral particles. Option C. Participating in primary hemostasis by aggregating to form a platelet plug. Option D. Maintaining systemic core body temperature variations. The correct answer is option C. Participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 4. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A. Informed consent. Option B. Implied consent. Option C. Verbal consent. Option D. Statutory consent. The correct answer is option A. Informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 5. Which of the following tubes contains a clot activator paired with a gel barrier separator? Option A. Gold top, SST. Option B. Light green top, PSD. Option C. Lavender top. Option D. Light blue top. The correct answer is option A. Gold top, SST. Gold SST tubes contain a clot activator and gel separator. The clot activator promotes serum formation, and the gel forms a barrier during centrifugation. PSD tubes contain heparin for plasma, while lavender and light blue tubes contain anticoagulants for other testing. Question 6. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A. Cephalic vein. Option B. Basilic vein. Option C. Median cubital vein. Option D. Brachial vein. The correct answer is option A. Cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 7. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A. Lipemia. Option B. Icterus. Option C. Hemolysis. Option D. Hemoconcentration. The correct answer is option C. Hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lightmere appears milky, and icterus appears yellow to amber. Question 8. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A. Transporting the specimen to the laboratory on ice. Option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C. Using a green top tube containing sodium heparin. Option D. Labeling the specimen tube at the patient's bedside. The correct answer is option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 9. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 10. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A. 30 seconds. Option B. 1 minute. Option C. 2 minutes. Option D. 3 minutes. The correct answer is option B. 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 11. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A. Advance the needle deeper to see if the pain stops. Option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C. Tell the patient that minor discomfort is completely normal for this vein. Option D. Instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 12. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A. Calibrating the machine once every year. Option B. Running control solutions at scheduled intervals according to facility protocol. Option C. Cleaning the display screen with water after every patient test. Option D. Trusting the automated self-check system without external verification. The correct answer is option B. Running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 13. Which of the following tests is used to evaluate the extrinsic pathway of the coagulation cascade? Option A. Activated partial thromboplastin time, APTT. Option B. Bleeding time test. Option C. Prothrombin time / international normalized ratio, patient / INR. Option D. Complete blood count, CBC. The correct answer is option C. Prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic and common coagulation pathways. They are commonly used to monitor warfarin therapy and assess clotting factor activity. APTT primarily evaluates the intrinsic pathway, and CBC measures cells rather than coagulation pathway function. Question 14. What does the term homeostasis mean? Option A. The stoppage of blood flow from an injured vessel. Option B. The steady state or dynamic balance of the body's internal environment. Option C. The destruction of old red blood cells in the spleen. Option D. The production of new cellular elements in the bone marrow. The correct answer is option B. The steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 15. Which of the following tests requires a 24-hour urine collection? Option A. Culture and sensitivity, C and S. Option B. Creatinine clearance. Option C. Routine chemical urinalysis. Option D. Pregnancy HCG confirmation. The correct answer is option B. Creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 16. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A. Lactic acid and ammonia. Option B. Cold agglutinins and cryoglobulins. Option C. Bilirubin and vitamin B6. Option D. Prothrombin. Patient. The correct answer is option A. Lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 17. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A. Gray top, sodium fluoride. Option B. Light blue top. Option C. Lavender top. Option D. Green top. The correct answer is option A. Gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 18. Which of the following additives is found in a yellow top blood culture tube? Option A. Sodium polyethylene sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Dethylenediamine tetracetic acid, EDTA. Option D. Sodium citrate. The correct answer is option A. Sodium polyethylene sulfonate, SPS. Yellow blood culture tubes contain SPS, which supports organism recovery by limiting complement and phagocytic activity. It also provides anticoagulation for the culture specimen. ACD yellow tubes are different and are used for cellular or genetic testing. Question 19. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A. Wearing a face shield when opening specimen tubes. Option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C. Washing hands with antimicrobial soap for 20 seconds. Option D. Following a strict order of draw sequence. The correct answer is option B. Utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 20. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A. Vein. Option B. Artery. Option C. Capillary. Option D. Venule. The correct answer is option B. Artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 21. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SST. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 22. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 23. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A, prothrombin time, patient. Option B, erythrocyte sedimentation rate, ESR. Option C, basic metabolic panel, BMP. Option D, blood culture series. The correct answer is option B, erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 24. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 25. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A, extensive hemolysis from using a small gauge needle. Option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Option C, icterus caused by elevated levels of circulating bilirubin molecules. Option D, failure to invert an additive tube immediately after collection. The correct answer is option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 26. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 27. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A, use the tube anyway if it is the only one available on the tray. Option B, discard the expired tube and select a current, unexpired tube from inventory. Option C, assume the additive inside is still functional for another 6 months. Option D, write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 28. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A, resin or activated charcoal particles. Option B, sodium polyent whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 29. Specimen tubes must be labeled at what point during the collection process? Option A, prior to entering the patient's room. Option B, immediately after drawing the blood, before leaving the patient's side. Option C, at the central processing lab desk. Option D, after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong-patient risk. Question 30. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A, collecting a lavender top tube for a CBC test. Option B, submitting an underfilled light blue coagulation tube. Option C, delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D, affixing a handwritten label over a pre-printed barcode label. The correct answer is option B, submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 31. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 32. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A, over-isotonic chilling. Option B, exposure to direct room light or sunlight. Option C, inverting the tube more than 10 times. Option D, delays in serum separation beyond 4 hours. The correct answer is option B, exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 33. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A, hypovolemic shock. Option B, septic shock. Option C, anaphylactic shock. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 34. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B. Releasing the tourniquet as soon as the first tube begins to fill with blood. Option C. Utilizing a needle with a large lumen, such as a 21-gauge needle. Option D. Having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 35. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A. Clear or plain red glass top. Option B. Light blue top. Option C. Lavender top. Option D. Light green top. The correct answer is option A. Clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 36. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A. Human immunodeficiency virus, HIV. Option B. Hepatitis B virus, HBV. Option C. Tuberculosis, TB. Option D. Malaria. The correct answer is option B. Hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 37. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A. Hematology. Option B. Microbiology. Option C. Clinical chemistry. Option D. Blood bank. The correct answer is option C. Clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing. Question 38. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A. Routine cholesterol screen. Option B. Workplace drug testing. Option C. Blood culture for endocarditis. Option D. Complete blood count for anemia. The correct answer is option B. Workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 39. What type of fire hazard is represented by the red quadrant of the NFPA 704 diamond? Option A. Flammability hazard. Option B. Health hazard. Option C. Reactivity hazard. Option D. Specific hazard. The correct answer is option A. Flammability hazard. The red quadrant of the NFPA 704 diamond indicates flammability hazard. It communicates how readily a material can ignite. Blue represents health, yellow represents instability, and white indicates special hazard information. Question 40. What is the correct clinical action for selecting a puncture site on an arm that has an active intravenous line? Option A. Draw from a site distal to below the line to minimize fluid contamination. Option B. Draw directly above the line insertion site. Option C. Adjust the flow rate to run faster during the draw. Option D. Draw from the line without flushing it first. The correct answer is option A. Draw Draw from a site distal to, below, the foreline to minimize fluid contamination. For fluids can dilute or contaminate specimens collected near the infusion source. When collection from an forearm is unavoidable and allowed by policy, a site below the fore is selected with appropriate coordination. The opposite arm remains preferred because it avoids infusion-related interference. Question 41. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Option B. Chilling the specimen on ice immediately after collection. Option C. Protecting the specimen from exposure to room lights. Option D. Mixing the tube gently 5 times right after the draw. The correct answer is option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 42. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A. Droplet transmission. Option B. Contact transmission. Option C. Airborne transmission. Option D. Vector-borne transmission. The correct answer is option C. Airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 43. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A. An N95 respirator mask and shoe covers. Option B. A standard surgical mask and gloves. Option C. A full-body Tyvek suit and goggles. Option D. No personal protective equipment is required. The correct answer is option B. A standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 44. Which of the following options defines the proper site for an adult capillary puncture? Option A. The thumb or index finger of the dominant hand. Option B. The lateral or medial plantar surface of the heel. Option C. The palmar surface of the distal segment of the middle or ring finger. Option D. The side of the pinky finger near the cuticle. The correct answer is option C. The palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 45. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A. 5 minutes. Option B. 10 minutes. Option C. 30 minutes. Option D. 90 minutes. The correct answer is option C. 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 46. Which of the following parameters must be strictly managed when collecting an arterial blood gas, ABG, sample? Option A. Protecting the syringe from exposure to direct light sources. Option B. Ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C. Inverting the syringe 20 times to mix the clot activator. Option D. Using a gray top tube to transport the arterial blood. The correct answer is option B. Ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 47. Which of the following parameters can cause a false elevation in a patient's serum bilirubin level? Option A. Exposing the specimen tube to direct room light or sunlight for an hour. Option B. Ensuring the specimen is kept away from light by wrapping it in foil. Option C. Centrifuging the specimen within 30 minutes of collection. Option D. Collecting the sample from a fasting patient. The correct answer is option D. Collecting the sample from a fasting patient. Fasting can increase serum bilirubin in some patients by altering bilirubin metabolism and hepatic handling. Light exposure usually lowers bilirubin by photodegradation, so it would not cause a false elevation. Proper bilirubin handling includes following preparation instructions and protecting the specimen from light. Question 48. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A. Potassium oxalate. Option B. Sodium citrate. Option C. Lithium heparin. Option D. DDTA. The correct answer is option A. Potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in grey tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 49. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A. Pearl/white top with gel barrier. Option B. Light blue top. Option C. Gray top. Option D. Yellow top with SPS. The correct answer is option A. Pearl/white top with gel barrier. Pearl or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 50. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A. 30 minutes. Option B. 2 hours. Option C. 4 hours. Option D. 8 hours. The correct answer is option B. 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 51. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A. Allowing a serum separator tube to clot completely before centrifugation. Option B. Balancing the centrifuge correctly with tubes of equal volume. Option C. Centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D. Keeping a plasma specimen chilled on an ice slurry. The correct answer is option C. Centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 52. What type of patient environment requires protective, reverse, isolation protocols? Option A. A patient with an active, contagious respiratory flu virus. Option B. A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 53. Which of the following elements is a key component of quality control in a point-of-care testing (POCT) program? Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 54. Which of the following parameters is evaluated when performing a basic metabolic panel, BMP? Option A, hemoglobin and hematocrit levels. Option B, the electrolytes, blood urea nitrogen, creatinine, and glucose. Option C, coagulation factor levels and platelet function. Option D, bacterial growth over a 48-hour incubation period. The correct answer is option B, electrolytes, blood urea nitrogen, creatinine, and glucose. A basic metabolic panel evaluates electrolytes, glucose, blood urea nitrogen, creatinine, and related chemistry values. It is used to assess kidney function, acid-base status, and metabolic balance. Liver enzymes, cardiac markers, and hematology counts belong to other panels or departments. Question 55. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 56. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 57. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 58. Which of the following items must be included on a computer-generated barcode specimen label? Option A, the patient's diagnosis and name of their insurance carrier. Option B, unique patient identifiers, date, time of collection, and phlebotomist ID code. Option C, the phone number of the patient's next of kin. Option D, the laboratory technician's home address. The correct answer is option B, unique patient identifiers, date, time of collection, and phlebotomist ID code. A barcode specimen label must include unique patient identifiers, collection date and time, and collector identification. These elements support traceability from bedside collection through laboratory reporting. Insurance information and unrelated personal data do not belong on the tube label. Question 59. Which of the following practices helps ensure compliance with standard precautions in phlebotomy? Option A, wearing gloves during all vascular access procedures and changing them between patients. Option B, reusing plastic tube holders as long as no blood is visible on the outside surface. Option C, washing disposable nitrile gloves with soap and water to extend their use. Option D, placing used lancets into regular trash cans if they look clean. The correct answer is option A, wearing gloves during all vascular access procedures and changing them between patients. Standard precautions require gloves for vascular access and glove changes between patients. This treats all blood and body fluids as potentially infectious regardless of known diagnosis. Reusing holders, washing disposable gloves, or discarding sharps in regular trash violates safe practice. Question 60. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, verbal consent. The correct answer is option C, implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 61. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 62. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A, polycythemia. Option B, anemia. Option C, leukemia. Option D, leukoplakia. The correct answer is option B, anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukoplakia involves white cells. Question 63. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 64. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A, proceed immediately to get the draw over with quickly. Option B, instruct the patient to take slow, deep breaths and offer reassurance. Option C, reschedule the test for a different week. Option D, administer a sedative if available in the room. The correct answer is option B, instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 65. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 66. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A, keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B, chill the tube in an ice slurry immediately after drawing. Option C, protect the specimen from light by wrapping it in heavy foil. Option D, centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A. Keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 67. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A, to eliminate surface bacterial contamination from the skin. Option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. Option C, to prevent the blood from clotting too quickly in the microcollection tube. Option D, to ensure that the blood flow is adequate for collection. The correct answer is option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 68. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A, a 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 69. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 70. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 71. What should a phlebotomist do if they encounter an unconscious patient in an emergency room with no identification band? Option A. Refuse to draw the blood until the patient wakes up and identifies themselves. Option B. Assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. Option C. Use the name written on the patient's personal clothing or belongings. Option D. Label the tubes with John Doe and leave the medical record number blank. The correct answer is option B. Assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. An unidentified emergency patient may receive a temporary unique identifier under facility protocol. Specimens are labeled with that identifier so testing can proceed while maintaining traceability. Clothing, belongings, or generic names are unsafe sources of identity. Question 72. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A. Layered drop upon drop until the circle is saturated. Option B. Applied to both sides of the paper simultaneously. Option C. Brought into direct contact with a single large drop to fill the circle completely. Option D. Smeared across the surface using a plastic capillary tube. The correct answer is option C. Brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 73. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A. Adjust the depth of the needle to stop the swelling. Option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. Option C. Advance the needle further to bypass the hematoma. Option D. Request the patient to pump their fist to redistribute the blood. The correct answer is option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 74. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A. Rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 75. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A. Sodium heparin and a gel barrier. Option B. Lithium heparin and a gel barrier. Option C. DDTA and a gel barrier. Option D. Clot activator and a gel barrier. The correct answer is option B. Lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 76. Which of the following options defines the proper order of draw for a blood culture, a lavender tube, and a gold SST tube? Option A. Blood culture, gold SST, lavender. Option B. Gold SST, lavender, blood culture. Option C. Lavender, blood culture, gold SST. Option D. Blood culture, lavender, gold SST. The correct answer is option A. Blood culture, gold SST, lavender. Blood cultures are collected first, followed by serum tubes such as gold SST, and lavender EDTA tubes later. This sequence protects culture sterility and reduces additive carryover. Drawing EDTA before serum can contaminate later specimens with anticoagulant. Question 77. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A, syncope. Option B, shock. Option C, vertigo. Option D, hemostasis. The correct answer is option A, syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 78. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option A, light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 79. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A, it causes severe tissue tearing upon skin entry. Option B, it carries an extremely high risk of causing hemolysis in the sample. Option C, it penetrates too deeply into the bacillic structures. Option D, vacuum tubes will lose their suction pressure entirely. The correct answer is option B. It carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 80. Which of the following is a symptom of nerve injury during a venipuncture? Option A dull ache in the antecubital fossa. Option B, a sharp, radiating, electric-like pain down the arm. Option C, a sudden feeling of warmth at the puncture site. Option D, small red spots spreading around the arm. The correct answer is option B, a sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 81. What is the definition of fomite in an infection control context? Option A, an insect that transmits a virus. Option B, an inanimate object capable of harboring and transmitting infectious agents. Option C, a chemical agent used to sanitize skin surfaces. Option D, a specific type of airborne droplet nucleus. The correct answer is option B, an inanimate object capable of harboring and transmitting infectious agents. A fomite is a non-living object that can carry infectious material from one person or surface to another. Examples include bed rails, equipment, pens, and contaminated trays. Vectors are living carriers, while antiseptics and airborne particles describe different infection control concepts. Question 82. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 83. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, To keep the needle sharp until it enters the vein. Option D. To guide the needle into the exact center of the vacuum tube. The correct answer is option B. To prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 84. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 85. What clinical condition is characterized by fluid accumulation in the intercellular tissue spaces, making the arm swollen? Option A. Lymphedema or edema. Option B. petechiae. Option C. Sclerosis. Option D. hematoma. The correct answer is option A. Lymphedema or edema. Lymphedema or edema describes swelling from fluid accumulation in intercellular tissue spaces. It may occur after lymph node removal, obstruction, injury, or other circulation problems. Drawing from a swollen limb can be difficult and may produce unreliable specimens. Question 86. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A. Serum layer. Option B. Buffy coat. Option C. Fibrin web. Option D. Thrombotome. The correct answer is option B. Buffy coat. The buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 87. What is the clinical term for an increase in the total number of circulating red blood cells? Option A. Anemia. Option B. Polycythemia. Option C. Leukemia. Option D. Thrombocytopenia. The correct answer is option B. Polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 88. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A. Vehicle-borne transmission. Option B. Vector-borne transmission. Option C. Airborne transmission. Option D. Direct contact transmission. The correct answer is option A. Vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 89. What is the primary function of the circulatory system's capillaries? Option A. Transporting blood under high pressure away from the ventricles. Option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C. Directing large units of blood directly into the vena cava pathways. Option D. Preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B. Permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 90. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A. Prone position. Option B. High Fowler's position. Option C. Supine with legs elevated or flat. Option D. Standing upright with assistance. The correct answer is option C. supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 91. What type of safety equipment should be accessed if a hazardous chemical splashes directly onto a phlebotomist's arms and torso? Option A standard eye wash station. Option B, a safety drench shower. Option C, a fire blanket wrap. Option D, an isolation gown station. The correct answer is option B, a safety drench shower. A safety drench shower is used when hazardous chemicals splash over large body areas such as the arms and torso. Immediate flushing helps dilute and remove the chemical to reduce tissue damage. An eye wash station is designed for eye exposure rather than full body contamination. Question 92. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWAC. Option B, culture and sensitivity, C&S. Option C, vulva and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWAC. An occult blood test, often using a GWAC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 93. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 94. What should a phlebotomist do if a patient states they have a history of severe syncope during blood draws? Option A, perform the venipuncture while the patient is standing up to keep them alert. Option B, place the patient in a recumbent, supine, position on a bed or reclining chair before starting the draw. Option C, tell the patient to close their eyes and hold their breath during the puncture. Option D, request a doctor to administer general anesthesia before the draw. The correct answer is option B, place the patient in a recumbent, supine, position on a bed or reclining chair before starting the draw. A patient with a history of severe syncope should be positioned supine or reclined before collection. This reduces fall risk and supports circulation if fainting occurs. Standing or breath holding increases danger and should be avoided. Question 95. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 96. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 97. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 98. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A, sodium citrate. Option B, DDTA. Option C, heparin, lithium, ammonium, or sodium. Option D, potassium oxalate. The correct answer is option C, heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 99. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A, royal blue top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, grey top tube. The correct answer is option A, royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 100. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A, 9:1. Option B, 4:1. Option C, there is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D, 1:1. The correct answer is option C, there is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection.